Well, welcome to the Aging Boomers. I'm your host, Frank Sampson. On this show, we discuss many of the issues facing boomers, their parents, and what we know is an aging population today. And thanks so much for all your support out there. Many of you have gone on to iTunes, have also downloaded our app on your iPhone or Android phone, and if you haven't done so, do it. Just type in the Aging Boomers, and you could listen to not only this show today, but many of the other shows that we have. And we've actually, I think we're on number 14 here, so we're pretty excited about that, and excited on our having our next guest is someone that I know is a friend, and she does just a great job, and welcoming Marcy Baskin. Marcy, you're there?
Yes, I am.
Great. Well, welcome. Marcy is a certified senior advisor and studied patient navigation at Sonoma State University. She then worked in a community clinic as a patient navigator and advocate. Marcy focused her efforts on elder care management and the impact on family members. So she started Elder Roads, an elder care consulting organization. She has assisted many families as a caregiver support group facilitator, elder care manager, and family coach. Marcy is also the author of a book called Assisted Living Questions I Wish I Had Asked. And that's a lot of what we're going to be talking about today, just some of the questions that families should ask, because usually, wouldn't you say, Marcy, when people are faced with this situation, considering whether it's assisted living, possibly nursing, hopefully not, but it's usually the first time they're confronted with this situation, correct?
Mm-hmm. Definitely.
Yeah.
It can take you by surprise. Even though you know your parents are aging or any loved one is aging, you watch them age, but for some reason we never really think about, okay, when they stop making their own decisions, how can we help them?
Right. And it's not like a lot of people have experience, and I guess, maybe you can talk about, because I know that you kind of got into the business because of personal experience. You want to talk about that?
Sure. My parents moved to California in 2006 under a lot of pressure from my sister and me, because we knew that they were ill and they were declining, and they lived in Florida, and obviously it would be very hard to help them so far away. When they moved here, they were living independently, but my father was quite ill on a physical level, and my mother was in early stage Alzheimer's. And I knew I had to do something to help them, and I had no idea where to start. And I had no idea who to call. I didn't know anyone who did the work that I and many others are doing right now, which is advocating for families and elders. So without knowing it, I went to boot camp for 6 years and took care of my parents, found the resources I needed, and somehow pieced it all together. It was very difficult, and it doesn't have to be, on a logistical level, it doesn't have to be that difficult. Help is available. The emotional part is a whole other ball of wax, and it's different for every family. But in terms of finding facts and information about what's available to you, that doesn't have to be done alone.
Yeah, so that experience led into writing your book, and you've also been working with families, of course. So it appears as though you have a guide for people, in a sense, if I can call it a guide, of types of questions, so they don't have to recreate the wheel. I mean, you went through some difficult times with with your mom, and kind of put together, in a sense, almost a diary of questions that you either asked or wish you would have asked after thinking about it. So tell us a little bit more about the book.
Okay, the book is more of a workbook than anything else. It's small and easy to carry around, and it's something that a family can take with them when they're looking at assisted living communities. There are over 200 questions in the book, and certainly I'm not going to give that all to you now, but I can tell you the categories of questions in the books, and some will resonate with you and some may not. So I start with talking about your very first visit to a community, and I'm not even talking about how do you find the communities. I will talk to that later, but your first visit, what do you look at when you walk in the door? What do you notice? What should you be looking for? What clues will there be that can give you an idea of how it might be for your parent or loved one to live there? And then we jump right into, what does it cost? I mean, it's good to know your budget before you go somewhere, but many, many people don't. And actually, sometimes people sit down with the marketing director at a community and they are shocked at how much it costs. So it's really important to know what your budget is, and because of that, ask questions about what happens when more care is needed. How much will that cost? I never asked that. It didn't even occur to me to ask that because I was just dealing with the present. What's going on right now? Okay, we need a place for Mom to live. She's got Alzheimer's disease. She's going to get worse. What are the next years going to be like? It still didn't occur to me to ask how things would change at the community for her when she declined. And that was a source of a lot of stress for me. My expectations were not managed, and I was constantly upset about finding out about a new policy, new to me, that is. I mean, it was their policy. And if you don't ask the questions, the conversation is completely driven by the person who's giving you the tour. And I believe so strongly that the family should be in control of the meeting when you go to a facility to check it out for your loved one.
So I have a couple questions on that. So
sorry.
I know you've mentioned community quite a few times. Why don't you explain what you mean by a community?
Well, a community, let me just go backwards a little bit. In the old days, before our generation started to age and our parents started to age, when someone got ill or got what used to be called senile or physically disabled, they went to a nursing home or they stayed at home. And that is not appropriate care for everyone who needs care. So slowly there evolved assisted living communities, and a community means that you are not living in a hospital. You are not living, in a room with 3 other people and being attended to all day. Assisted living is usually for people who need some help with medication management or need some assistance with some of the activities of daily living, like dressing, bathing. And there are a lot of activities and group efforts to have people learn about each other, the residents socialize with each other, be engaged. There are opportunities for that. And it can be pretty enjoyable for the right kind of person. So I don't know if I answered your question.
No, you did. And there's all different shapes and sizes of these places, mm-hmm. right? Yeah.
Absolutely. The place my mother lived in was one of the larger communities, and there are many, 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 many options. Here in Sonoma County, we have 172 assisted living options. And assisted living, all the listeners should know, is always a non-medical option. If someone needs constant medical attention, it's not for them. Non-medical means that, yes, they will help, they will remind you to take your medicine. They will actually bring your medicine to you and make sure you take it. But very basic wound care they can do because most communities have a nurse on staff. But that's it. And even my dad had diabetes, and he had to be injected 3 times, 4 times a day with insulin, and he could not go to assisted living because he was not able to do it himself. So that's just one example of something they will not do in assisted living.
Yeah, it's interesting. A lot of people aren't aware of these, this step before nursing, and actually nursing may not even play a factor in someone's life. We call it assisted living, but sometimes people just need supervision,
Yes.
and that's it. Maybe medication management, and just make sure that someone's there in case they do need any help, and that's assisted living as well. If an elderly person can't be at home alone, but you mentioned something before which I'd like you to expound upon. Now, you wrote a book about the types of questions to ask. Okay.
Mm-hmm.
But at the same time, I know you work with families to help them in finding the right place and guide them. All right.
Mm-hmm.
But you mentioned that families kind of need to take that lead. So explain to you, how do you do that? So when you're working with a family and you're helping them in finding the right place for their loved one, do you kind of like brief them then on the types of questions they should be asking, even though you may accompany them?
Absolutely. I definitely educate them on what they might want to look for. I get to know the family first, and what matters to one family does not matter to another family necessarily. And so there are the basics, and then there are the more subtle things, like the expectation that your loved one is going to participate and engage in activities, but really they've been a loner and a quiet person their whole life. So the activities are not going to be that important to that family. And to others who are very social, that is a very important thing. I go through everything that is in my book and more with the family, and I coach them so they are able to ask the questions themselves. I don't think it's as meaningful for a family to bring me along and have me do all the talking. And I think it will mean far more to them to ask the questions that they will feel more empowered, because it's a very disempowering feeling to watch someone age and see them declining. So I try and help the families feel their power, and they are the ones ultimately who are going to be making the decisions, not me. So I'm just kind of their quarterback. They sometimes need resources, or they might need a referral for a geriatric physician because they just moved here from another state. I help them with all those kinds of things. But in terms of going on the tour, it's their tour. I usually walk behind them, but close enough to hear everything that's said, and let them use the questions that I advise them. And I always give them a copy of my book, and they can write in it and use it as a guide.
That's great. I would think also it's not only them empowering them. I mean, that's important, but it's also building a relationship. I would think if they're going to have their loved one, whether it be a husband, a spouse, or a mother, father, live there, they're going to be dealing with the various people at that particular community, as you said. So they need to build that relationship. So I think that's great the way you do that.
Yes, definitely.
Yeah.
And the relationship I build with them is really fantastic. There are people that I helped find accommodations for over a year ago, and I occasionally visit them now still, because I'm driving by and I think of them, and I had a relationship with them. The family's not paying me. They're not asking me to visit. I always ask permission from the family, but I do visit clients from a year or two ago, and I love that. I love that happened.
But I think the other benefit is that you visited the places themselves. So before you bring a family member there, have you seen those places?
Yes, definitely.
Yeah.
I will never send a family, even if they want to go. There are very few, but there are some families, because of scheduling or privacy issues or whatever, they want to go by themselves. They want to use me for my expertise, and then they just want to go do it. I would never take anyone or send anyone to a place that I haven't seen with my own eyes, and ask my own questions.
Yeah.
So I know what they're walking into.
And the nice thing about it, from a family budget standpoint, I would say in most cases, there's not going to be a cost to them in this scenario, because you've set up agreements with the various communities, assisted living facilities, and earn a commission. Is that correct?
Yes.
Yeah.
I do charge by the hour for my elder care management, but when it comes to touring facilities, when I first started out, I just charged people by the hour, and whatever we did, we did. And it gets kind of expensive having me drive someone from place to place to place. It's a lot of hours. And I guess it's okay to say this. Then I met you, and we decided
Right.
to work together, and I didn't even know that placement was done that way.
Yeah.
And it's really worked out for me. It feels really good to me that I can save my clients money and time.
Yeah, but let's talk about, which is great, but you're unique in that not only do you help them with placement, but if they need help with other things, like you said, you charge hourly for your time. Let's talk about that, and maybe give some examples of types of either projects or types of assistance that you provide.
Well, I think one of the primary things I get hired for is to help the family make the decision in the first place. To sit with all the family members, hear them out. More often than not, there are family dynamics in play that I have no idea about, and it's really hard for families to make decisions together when that's going on. So I become a facilitator. And actually, sometimes I realize that it's beyond my scope of practice what's going on in a family, and I refer them to a family therapist. And sometimes they'll go, sometimes they won't. But I am not a social worker, and I'm certainly not a licensed therapist. And sometimes the issues are too big. But I kind of digress there. I apologize. Navigating the healthcare system is a big one. On a very simple level, sometimes people are very intimidated by their physicians. So the physician might say, take this medicine or do this or do that, and they just do it, especially the older generation. I think we baby boomers are quite different.
We're rebels, huh?
Pardon?
We're rebels, the boomers.
Oh, yeah, in every way.
Yeah.
So when I was going through this, I had to sit down with all my parents' physicians. They had far too many. And they came here from Florida with a mishmash of medical care and prescriptions, and none of the physicians knew about the other ones, which is dangerous. And, I sort through that with them. One of the most common recommendations, because I deal with so much dementia, I ask them if they've ever seen a neurologist and if they, in fact, have a diagnosis. And if they say no, I have to be very careful. I'm not a medical professional, but I suggest strongly that they get a referral from their primary care physician for a neurologist. And what happens quite often is they go into their doctor and they say, I would like to have a referral for a neurologist. And the doctor says, why? What for? And that's kind of where I come in. I mean, I sometimes accompany people to medical appointments, and I'm not there to be a bully, but I'm there to be sure that they are not bullied, and that they're getting the attention that they deserve, and the respect they deserve. That's a big one. I go to a lot of medical appointments. And what I understand from my own experience is that people who are normally very competent and able to rise to any situation, when it comes to taking care of someone they love and making decisions, they are overwhelmed, and they're going through sadness and tremendous loss and fear sometimes about not knowing what to do. And that's where I come in, to help them sort through all that and also give them a lot of support.
It sounds like you're more like just an advocate for the family.
I am an advocate. Right. I advocate for every family I work with. Right. And my training at Sonoma State, even though they don't call it patient advocacy, that is what it was. Mm-hmm. So
it's great.
I think that's
great. No, that gives us
a really good overview of what I do. I mean, there's lots of small tasks that live inside of each of these things, but I just want to make sure people get the best care they can and that they're being heard and seen, and I see them and I hear them, and I think sometimes that's very healing for them.
So, obviously I've been in the business a while, but I would love you to explain and have people understand that even if the family's not ready to make that move, you still might be able to help them, right? I mean, you might have a family that says, we're just not ready to move Dad yet. Mom's at home with them and is just having a tough time letting go, but she could use some help at home. Mm-hmm. So is that an area that you help with as well?
Yes. I am familiar with many of the home care agencies in our county, and I interview them with my client. Once my client gets their parent to agree to accept help, and sometimes I am hired to talk to the woman who's taking care of her husband with Alzheimer's at home and is clearly deteriorating from that task, and to talk to her not as her child, not as her family member, just as a concerned person who knows about the senior care industry. And it sometimes works. A lot of times people don't want to have conversations with their children because they're hard. And which leads me to another thing I do is help people make sure that all their paperwork is in order. Right. Advance directives, posts, and also if they need legal counsel or financial counsel, I have so many resources that I can refer to in our senior care community. That's why I used the word quarterback earlier, because that's what it feels like to me. Sometimes I'm doing something very directly and very personal and very deep with a family, and other times I'm finding them the resources that they need to get through this.
It's a great service.
It's quite. I'm sorry?
I said it's a great service. It is.
It is a great service. I wish I had someone who did that with me when I was going through it, because I was lost.
Right.
And I already explained what that was like. So, I'm kind of on a mission here about helping people find their way through this maze. It is a maze.
So what would you recommend to families? Let's say they didn't know about your service or a service like yours, and they're confronted with the situation. I mean, where do you suggest they turn, just at least initially, for help? Any suggestions to families out there?
Well, there's always Google. So that's one.
But a lot of people rely on their doctors, I would think, for suggestions. Whether they're the right suggestions or not is something else. But I think a lot more people do Google. But would maybe area? I mean, the section on aging or any other organizations you could think of that they could turn to?
Of course, the section on aging here in Sonoma is, as you know this, Frank, but this is for your listeners, is a group of approximately 150 professionals who all work in the senior care industry. And we meet once a month, and we problem solve together, and we get to know each other personally so we can refer to each other, because certainly none of us does everything. So in your area, look for I don't know what it's called in other states. Just here, it's Section on Aging.
Yeah.
There's your usual area.
Area Agency on Aging. I think
the Area Agency on Aging.
Yeah.
I always forget their AAA order.
AAA,
and then the Council on Aging.
Right.
And there's so many people getting older right now, meaning the boomers, that there are a lot of resources out there because, as you said, we're rebels and we just don't take it as it's offered necessarily, and we want answers. Right. So people are starting businesses to give people answers. Yeah. Some of them are nurses, which I think is really great. It doesn't mean that I'm not a nurse, but I'm really good at what I do. But for some people with more medical issues, they might want to work with a nurse advocate. There is an organization called, this is a good one for across the country, APHA. Don't ask me what it stands for right now, but I am a member. And you can find patient advocates through that agency. And I think it's a very, very good agency. They're honest and their hearts are in the right place.
Great. Well, Marcy, unfortunately, we got to go. We could talk forever about this subject. Matter of fact, we do. We talk a lot about it.
Yeah, I was just going to say we do.
Yeah, we do. But Marcy Baskin, Marcy, if someone wanted to get a hold of you or get a hold of your book, how would they go about doing that?
Okay, on my website, it's www.elderroads.com. You can get my book on my website, and you can read about my practice on your website. And I do work on the phone for perhaps adult children who have parents who live here. I can help them with that.
Great.
And
great. Well, thanks so much for coming on.
Pardon?
Thanks so much for coming on the show.
Oh, you're very welcome. I really enjoyed it. Thank you, Frank.
It was a lot
Thanks
of
for
fun.
all you do.
Yeah, it was a lot of fun. And thank you all for listening. And again, send your friends and family either over to iTunes, or you could send them right over to our website at theagingboomers.com. Also, all the shows are on my website at seniorcareauthority.com. Or you could download the apps on iTunes or on your other smartphones. So again, thank you so much for joining us. Be safe out there, and we'll talk to you all soon.